Cardiovascular disease is one of the biggest causes of early death and disability through heart attack, stroke, and dementia. And much cardiovascular disease is caused by conditions like blood pressure, high cholesterol, and atrial fibrillation, or AF. That's one of the common causes of an irregular heart rhythm. Now, if you have one of these conditions, treatment works very well and it's very effective at preventing heart attacks, strokes, and cases of dementia. The problem comes that many people with these conditions have no symptoms, and a lot of people therefore don't know that they have the conditions, or if they do know, they don't know that their treatment's not working for them. So, for example, around a third of all people with high blood pressure are undiagnosed, and even when they are diagnosed, around a third don't have their blood pressure under full control with their treatment. So using data to improve how we detect and treat people with high blood pressure, cholesterol, atrial fibrillation will really help us to make a big dent in cardiovascular disease and have a big impact on the health of Londoners. If we join up anonymised data, so that's data that's depersonalised, anonymised, join up data across practices, GP practice and hospitals, for example, this will show us in communities across London how many people there are with conditions like blood pressure, cholesterol, atrial fibrillation that are not well controlled. It'll show us how many people with these conditions are getting heart attacks and strokes, for example. And we'll be able to identify communities where there are the greatest numbers of people who need their treatment improving. This will show us where we need to improve our services and how we can focus our resources to get best treatment for Londoners with these conditions. We've done some clear modelling in the NHS that will show us that we will prevent up to 2,000 heart attacks and strokes and cases of dementia across London every year. So that is huge, and it's all underpinned by data, understanding the problem, understanding, knowing where to focus your resources.